So we had seen yesterday about the fourth unit, which was disorders and health problems of a child. Under that we had seen infancy. Under that first topic was failure to thrive. I hope you all have got. If any problem, you can ask once I stop summarizing. So failure to thrive was what? Any idea, Fareen? Although I remember only some names. Fareen, you have any idea regarding it? I have very clearly mentioned and very clearly stated that what does failure to thrive means. Jaldi bolo. If you know also, you can say. If you don't, still you can say you don't.
नो
Gagan,
मैम।
Gagan, you are
इसमें है ना
there.
मैम, वेट लॉस होता है बेबी का कंटिन्यूअसली।
So what failure to thrive means what? Failure to grow or failure to gain or maintain a particular infant's weight, okay, or grow or develop properly, or else you can state as slow physical development in a particular infant or a particular baby or a child. Understood? Which can be caused by how? If a person or if a particular infant is not having or intaking much of a nutrition, not enough nutrition which is being required for a particular baby. Under that, we had seen definition from textbook of Wong's. Then we had seen other definition, and then we had seen etiology. First, we had seen organic failure to thrive. Organic means what? When there is an involvement of any underlying medical cause, that will come under organic failure to thrive. Next one was non-organic failure to thrive, under which if no known medical condition is being found, still growth and development, especially the growth is poor, then it will come under non-organic failure to thrive. Next was idiopathic failure to thrive, which was unknown. Idiopathic means what? Gagan.
अननोन।
Gagan नाम है आपका? Where is Gagan? Twice I had taken his
Yes,
name.
ma'am.
What do you mean by idiopathic?
I don't know, ma'am.
Pardon, I can't hear you.
I don't know, ma'am.
Unknown cause.
Okay,
Without
ma'am.
any cause which is unknown, it can be anything. Idiopathic failure to thrive means failure to thrive due to any unknown cause. Next, we had seen intrinsic and extrinsic factors. Who's this? Mute yourself. If you are not interested, Gagan and others, whosoever are with you, you can please leave and you can go. Any sort of nuisance will not be encouraged here. If you are not interested, you can please leave and go. Next was intrinsic and extrinsic factors. For intrinsic means what? Anything related to inside in the body, if any absorption is there which is defective or anything, and nutrients, malnutrients, whatever present in the body or whatever present in the particular substance is not being absorbed by a particular body. Then metabolic disorders, as I told you all, any problem in the metabolism. Then any chronic disorders. Next was extrinsic, outside factors we had seen, which was inadequate nutritional intake. Nutritional intake is only not proper. And social and environmental deprivation. Deprived also I have told, socially withdrawal babies or infants or environmentally withdrawal. Other factors were there. Signs and symptoms we have seen, mainly important were failure to gain weight despite of taking proper caloric diet or intake. Then organomegaly or lymphadenopathy, which I have clearly told you all. What is it? Organomegaly is enlargement of any organ, which can be liver, spleen, lymph nodes. Lymphadenopathy is enlargement of lymph nodes, which can be in response to any regional infection or any inflammation. Next was recurrent vomiting, diarrhea, dehydration. General were wasting, as I told you all about kwashiorkor and marasmus in the next slide. Those sorts of babies will be there. Cardiac and pulmonary we had seen under that cyanosis, clubbing, respiratory distress, murmurs. Then we had seen abdomen, skin and hair, nutritional factors, psychological descriptions, developmental retardation, diagnostic evaluation, management, therapeutic management, medical management. Again, we will start from medical management, which was regular monitoring of growth and development. I told you all regarding this that how it will be helping out. Like regularly, if they will be monitoring growth and development, they will definitely foster. Like if a particular infant's growth and development, growth is how, like how they are reacting, how their growth and development is hindered, like how reflexes are working, how they are developmentally, they are stable. Who else is joining? So late you all are joining now. Reena. Reena, from tomorrow, please come on time. The next was treatment of any organic causes. As I told you all, organic means what? Organic and non-organic means any, if involvement of any medical cases are there. First you have to rectify that, and then for the treatment of failure to thrive they have to come. Hospitalization, I told you all, evidence of severe acute malnutrition. How, what I told you all about this will be anything. Severe acute malnutrition is what? It can be defined by very low weight or weight for height. It can be length also, it can be mid-arm circumference. Basically you will be seeing in children, like in infants, like severe acute malnutrition may their mid-arm circumference will be less than 115 millimeter, or there will be a presence of edema in the particular baby's body. But what can be the sign and symptoms of severe acute malnutrition? It can be any, if the baby or the infant is not interested in food, or they have lack or no interest in the appetite also, loss of appetite will be there, irritable they will be all the time, they will be maybe tired, they will have no or loss of fat, it will be there, or no fat at all, or else they will be depressed. Next was caretaker substance abuse. If the mother is into any substance abuse or psychosis, then that time hospitalization need will be there. Outpatient management, as I told yesterday, that does not result in weight gain. आपको कोई भी वेट गेन करने के लिए हाउ व्हाट इज द इम्पोर्टेंस, वेट गेन करने के लिए आप hospital say if you all are taking IV fluids also, that will not be increasing the weight. Naturally, if a child is having failure to thrive, definitely he will be needing nutrients in the body. वो कहाँ से आएंगे? खाने से आएंगे. This was all about this. Then nutritional rehabilitation. Nutritional rehabilitation, we have something like high calorie formulas that offer more than 20 calories per ounce. If you talk about ounce, 1 ounce will be equal to 218 kilocalories, you can say. So simultaneously 200 kilocalories per 1 ounce, if I am saying, that will be 0.914 ounce. You just have to remember this, that how much it is there, or else you can just simply write high calorie formulas that offers more than 20 calories or kilocalories per ounce. Next will be high energy milk. They are to be given. These are all nutritional rehabilitation. What has to be given to the babies. So high energy milk that supplies 100 calories per 100 ml. That will be milk 100 ml, sugar 1 teaspoon, oil half a teaspoon. So that whatever they are including in the particular baby's diet, that should be including milk. If they are including, that should be 100 ml, sugar 1 teaspoon, oil half a teaspoon. And cereal milk and thickened feeds, which can be 100 ml of milk along with 2 teaspoons of cereal, or it can be flour, or sat mix are beneficial. Ab sat mix is a new term which has been written over here. Sat mix is nothing but a pre-cooked ready-made, you can say ready to eat. It can be powdered, it can be roasted mixture which is prepared either with rice, wheat, black gram or sugar. Sat mixture क्या है? Mix, whatever mix you call it, is pre-cooked ready to eat. Pre-cooked है, पहले से बना हुआ है, which is can be in powdered form, it can be in roasted form, और which is being prepared by what, किस किस चीज से बना सकते हैं. It can be made from rice, wheat से बन सकता है, rice से बन सकता है, black gram से बन सकता है, और else sugar. बट उसकी क्वांटिटी हैज टू बी मेंटेन्ड, क्योंकि सैट मिक्सचर है तो ये सारी चीजों से बनती है. उसकी क्वांटिटी विल बी 1:1:1:2. That is 1% of rice, the other one is wheat, the other one is for black gram, and 2 is for sugar. Understood? Any doubt you all can ask in this, that is under nutritional rehabilitation. Next is a weight gain of half kg per day is being expected. Whatsoever baby's weight will be there, as we have seen in the previous slide. Over here in the slide we have seen regular monitoring of growth and development. So over here, once you will be monitoring the growth and development as well, you will be monitoring the weight as well. So in order to maintain weight, first of all you have to give certain supplements. We have seen here what all supplements. High calorie formulas had to be given. Energy production, high energy products, milk and milk products should be given. So basically under that we will be seeing weight gain of half kg per day is being expected. Simultaneously, supplementation for older adults will be included, like they can eat meat products if they are non-vegetarians, oil, cheese, sour cream, butter or peanut butters to meals. Sour creams, I hope you all know. If you all don't know, otherwise you all will be aware. You might be aware of the topic like meat, oil, cheese, butter, peanut butter. Very additional thing is sour cream. Sour cream, sour, you mean, what does sour means? 1 minute. Alka, you are there in the group. Only 30
Yes, ma'am.
students are there in that. Alka is there. Alka, tell what does sour means. Sour का मतलब क्या होती है? जल्दी बोलो. If you know, if you don't know, pass it on to somebody else.
नहीं पता मैम.
Don't sit and listen just like deaf and dumb students. You have to respond. If it is a one way only, alone I will say and you will sit quietly. सार का मतलब नहीं पता है. स्वीट का मतलब पता है का? स्वीट का मतलब पता है? हेलो, स्वीट का मीनिंग पता है आपको? हेलो, am I audible?
Yes, ma'am.
Yes, ma'am.
स्वीट
Yes,
का
ma'am.
मतलब पता है?
Yes, ma'am.
Senior.
मैम कौन सा स्वीट? एक मिठाई होती है, एक मीठा होता है.
स्वीट का मतलब मीठा
और एक
होता है, तो
खट्टा।
सार का मतलब क्या होगा?
Khatta.
खट्टा।
हाँ, खट्टा. Who said? जाओ. Sour cream is what? It is nothing but it is a fat content which has around 20% of the fat in it. It is made up of what? By mixing or by adding lactic acid and bacteria in a combination of cream or you can say milk, and then you will let it thicken and then it will turn sour, and then you are supposed to administer to the babies. But don't mix sour cream with yogurt, because yogurt is what? Fermentation of milk and not the cream. यहाँ पर cream का fermentation हो रही है along with lactic acid bacteria in order to form and in order to make this combination of cream and milk, and then you are supposed to make it thicken, and then you are supposed to, when it is turned sour, that time it is being given. Why it is given? Because it is a fat content which has around 20% of the fat. Next is multivitamin supplementation, which includes zinc and iron. Next, tube feeding in certain children, those who are with like yesterday which we had seen, nasogastric orogastric tube feeding is being given to certain children. So if some tube feeding is being given to the particular child, in that way may you are supposed to give these all supplementations via tube. Next, feeding guidelines is there. If somebody is, or if some children are in under feeding, so for that you're supposed to first of all provide a quiet and an unstimulating atmosphere, very quiet environment, so that the children, the parent as well as the child is being focused in the particular scenario, and unstimulating atmosphere where no other distractive sources are present. Next is they are supposed to talk with the child by giving directions about eating, so that if a toddler, if for instance if it has been he or she is feeding himself, खुद से खा रहे हैं, वो टाइम में क्या होंगे, the direction should be given कि ये माउथ में ले लो, स्पून से मिक्स कर दो, and then you eat, like that way you're supposed to say. Then be persistent. You have to be persistent means constant रहना है. ऐसे नहीं आज you are sitting with the baby, you are giving a quiet and a unstimulating atmosphere, then again you are giving, आज direction दे दे रहे हैं, tomorrow you are not giving, then again third day you are giving, so baby will not be in a sequence में it will not be there. Baby will not be used to the particular thing. So these are the 3 points you'll remember. Next, more points are there, like maintaining face-to-face posture with the child when in possession. You can see the picture which is right in front of you on the very right bottom corner of the slide, which is maintaining face-to-face posture along with the child whenever possible. Like, if you all are listening to the class, Kunal, how you are texting in the group? If you want to use WhatsApp, then better use WhatsApp only. Don't come and listen to the class. Next is introducing new food slowly. You should not introduce every food every now and then, like today, tomorrow. You are supposed to introduce new foods daily, slowly, sorry, very slowly, not every day. You should not mix up and change. Next, follow the child's rhythm of feeding, not like the baby is not infant or baby or toddler, whatsoever it is. They are not finishing the mouth food and you are installing the other. You should not follow that. Then you are supposed to develop a structured routine. A particular routine should be followed, that this particular time baby is to be fed with this thing, the second moment of time it is to be fed with this thing, that you're supposed to keep in mind. Next is about a chart which is a normal child protein energy requirement and a failure to thrive child protein energy requirement. You all can refer this. If any doubt, you all can ask, because it's just an age. Then protein, which is in gram per kg, and energy, which is kilocalories per kg. Similarly, it is for normal child, and same likewise it is for the FTT child. So moreover, you can see, because the child is a malnourished child, you have seen in the sign and symptoms yesterday, they do suffer from kwashiorkor and marasmus as well. So they have very लो एनर्जी, कोई भी बॉडी में कोई न्यूट्रिएंट मैक्रोन्यूट्रिएंट माइक्रोन्यूट्रिएंट नहीं है, दैट इज वाई उनको ज्यादा कैलोरी का नीड है. सो यू कैन टैली दिस चार्ट एंड यू कैन रीड. फॉर इंस्टेंस, लाइक वी वर सीइंग अ टॉडलर एज ग्रुप, सो वी विल सी 1 to 3 एज ग्रुप में कितना नॉर्मली चाहिए. प्रोटीन चाहिए 1.2 ग्राम पर केजी, बट अ चाइल्ड हु इज सफरिंग विद failure to thrive, they will be needing 2.5 gram per kg. Similarly, energy requirement for a toddler 1 to 3 years of child will be 102 kilocalories per kg, and failure to thrive child will be needing approximately between 150 to 250 grams per kg. Please refer this. If you all have any doubt, you all can ask. It's just a chart showing difference between a normal child protein and energy level according to the years, as well as failure to thrive child according to the particular age group. Next is the surgical management. First of all, very importantly, surgical care is most often not needed unless an underlying condition is present, such as if a patient is, or if a child or an infant is having cleft lip. So first that should be repaired, and then any other thing can be done, because failure to thrive is what? They are like fighting to thrive. They are not able to, like, they are no growth, no, they are like failing to gain weight, not maintaining proper weight of the particular baby. So how, if an underlying cause is there, like we had seen in the causes, any organic or non-organic, agar organic hai, for instance, organic cause hai cleft palate, so that particular cause first has to be repaired, and then they should focus on any other thing. Or else, if a gastrostomy feeding tube is being placed, so wo time mein pehle severe cases ko you are supposed to rectify, and then you are supposed to come into this. Let's discuss about counseling. Counseling of both parents is mandate for a baby of condition like this. इतना लेट, if you all will be joining every time टी करेंगे तो how will I manage? Every time I have to close that and फिर से बार बार आकर इसको adjust करना पड़ेगा. जयती, प्लीज ज्वाइन इन टाइम. इतना लेट ज्वाइन करेंगे, क्या समझेंगे आपको अभी? Next is levels of prevention. As you all might be aware about the levels of prevention, there are 3 preventions in general, that is primary, secondary and tertiary. Jayati, itna late aayo, now answer this question. Levels of preventions, we have primary, secondary and tertiary. Do you know the basic meaning between primary, secondary and tertiary? नहीं मालूम है तो प्लीज पास, बट डोंट वेस्ट टाइम.
मैम अभी रिमूव कर दिया था किसी ने.
क्यों रिमूव कर रहे हैं? खेलने के लिए यू पीपल आर कमिंग ऑन.
मैम पता नहीं, अभी अभी करा है किसी ने.
Anyhow, You say, what do you mean by primary, secondary and tertiary? Any knowledge you have regarding this primary, secondary and tertiary? हाँ नहीं तो बोल दो. You have or you don't have?
मैम आपका माइक म्यूट हो गया.
Hello, you all can hear?
यस
Hello?
मैम.
हाँ तो कहाँ से म्यूट हो गया फिर? Half of the people can listen
मैम
and
अभी
half of the people can't listen. Hello?
यस मैम.
If you all can't listen, then it is your network issue because my mic is on only. Levels of prevention, I was asking you all. Any idea regarding levels of prevention?
यस मैम.
Primary, secondary and tertiary. We have three. Primary includes what? Those measures that can prevent the onset of illness before any disease begin. कोई disease होने के पहले जो भी आप prevention कर रहे हैं, that is under primary prevention. Secondary prevention है कि आप अर्ली डायग्नोसिस कर लो वो ट्रीटमेंट के लिए. टर्शियरी इज अब डिजीज हो गई है, वो टाइम में यू आर मैनेजिंग डिजीज. जब डायग्नोसिस आ गई है और उसको स्लो करने के लिए वो डिजीज को, और एल्स वो स्टॉप करने के लिए वो डिजीज यू आर प्रिवेंटिंग, दैट प्रिवेंशन विल बी कमिंग अंडर टर्शियरी प्रिवेंशन. अभी जनरल समझ में आया व्हाट इज प्राइमरी, सेकेंडरी एंड टर्शियरी प्रिवेंशन? एनी डाउट यू ऑल कैन आस्क लेटर. बात पे मत बोल दो माइक म्यूट थी, नेटवर्क नहीं आ रही थी. इफ यू ऑल आर नॉट कंफर्टेबल, अभी नहीं समझा है, यू कैन से इट नाउ ओनली. गॉट?
यस मैम.
ओके. Primary prevention में we will see primary, secondary, tertiary altogetherly three. First of all, primary prevention. Under that what? Good antenatal care. Mother जब pregnant है वो पूरा duration के time में certain care is to be given. Then parents should understand the needs of the baby. What is the particular baby's need? For instance, I told you all yesterday what nutrient is to be given to the baby and when it is to be given. Then nutritional counseling to be given to the parents as well. Then the children, the parents attitudes and the behavior should be contributed. How, what behavior they had to, their behavior had to be contributed in the child's problem, like, or else if the child is to be examined, in that particular case that particular child is to be examined and the attitude of the behavior and the attitude of the child as well as the parents is to be taken in mind. Then you have to take the chairs for a regular visit, the particular infant or the particular child, for normal health, growth and development, as we had seen that in the management itself, that they have to be taken care of regularly and growth check has to be maintained. Then doctors had to be reported as well as the doctor ask the particular concerned caregiver of the baby should ask the doctor regarding what? About proper parenting of that particular baby or else nutrition of that particular baby, that what particular type of nutrition is to be given in the early life of the baby. For instance, if it is an infant, उस time में उसको क्या दे देना है, or else the parents should be encouraged like to attend any parent or parent training sessions which are being organized by the hospital, whether they have to attend those or no. Then said if at risk some babies are, तो वो risk में at risk में 3 points will be included. अगर कोई भी parent is a known depression case का, वो लोग को is to be taken special care. Then patient parents को सब कुछ समझा रहे हैं but that particular time में they are not able to understand only. लैक ऑफ अंडरस्टैंडिंग है, बेसिक जो भी चिल्ड्रन के लिए केयर चाहिए और एल्स इन्फेंट केयर इश्यूज होते हैं वो लोगों को, तो वो इफ दे आर नॉट एबल टू लाइक गिव दैट पर्टिकुलर केयर टू द बेबी. नेक्स्ट इज पावर्टी. इफ गरीबी है घर में तो वो दीज आर एट रिस्क केसेस विच हैज टू बी dealt in the primary prevention itself. Talking about secondary, which I told you all, this prevention includes what? Those types of measures that can lead a person or an infant to an early diagnosis and prompt treatment, which you all have heard earlier as well. This involves monitoring, same thing has been written here, monitoring and intervention when these risk factors or situations are identified in a particular family or in a particular infant. Next is talking about the tertiary prevention. First of all, 1 minute. Next time say if you all are coming, please don't come. अब क्या 10 minutes के लिए you all have joined. Anyhow, tertiary prevention, first of all, close follow-up should be there. As I told you all, if any type of psychopath mom or else psychopathy is been formed, where there that particular caregiver is being referred to a psychologist should be referred. If any neglect from the side of the caregivers has been suspected, that particular time child protective services should be involved, so that in order to protect the child, in the just 5 to 10 slides back he has seen about child protective services. Then pediatric, medical और surgical सब specialist should be involved. अगर क्यों involve करेंगे ये लोग? Because अगर कोई भी long term treatment का need है or else monitoring is required in cases of organic failure to thrive, वो time में ये लोग का need है. Then pediatric feeding therapist, if any sort of, I told you all, gastrostomy is been done or else any feeding tube is there, that particular time में these people की involvement रहेगा. Next will be common management. Overall, this was all about, we have seen management we had started, yes, since yesterday we are seeing which was first of all management he had seen, then therapeutic management he has seen, medical, surgical, hospitalization, nutritional management, then we had seen about counseling, then levels of prevention, primary, secondary and tertiary. Now next is normal nursing management. Under that, assessment of child to establish best intervention plan. Next is the assess the child's feeding behavior. What baby does feel like having, क्या उसको likes है, क्या उसको dislikes है, that feeding particular behavior has to be monitored. Then you have to observe. In the very first day topic I told you all, observation of the interaction between child as well as the mother as well as जो भी other caregivers baby के साथ पे है वो, or else not only in the feeding process, not only in the process of feeding as well as caregiving activities may, play and recreation may as well. Then measurement of proper measurement of weight and height calculations की कितनी बढ़नी है, because this topic is all about failure to thrive. So very importantly, weight, height monitoring, mid-arm circumference monitoring, ये सारा monitoring should be accurate in number. Next, under this only, which is the normal common nursing management, child's activity level. How far is the baby is active? Whether the baby is not retarded or no, whether the growth of the baby is very slowed or no. On interactive patterns, developmental milestone, कितना बढ़ना है, कितना एज के अकॉर्डिंग उतना उसका activities है या फिर नहीं. Then you're supposed to observe how child does indicate for any sort of hunger, satiety, or any sort of touch, or else you see how the baby will be indicating. Some babies for hunger, for infancy or toddlers, they will be crying if they are hungry or they are lethargic, or else how they will be soothed. Means for some babies, if you will take them baby around over here and then they will be all right. So the ability of the child to be soothed means कैसे वो ठीक हो जा रहे हैं. Whether if you all are cuddling with the baby, you are touching the baby properly or holding the baby properly, वो time में चुप हो जा रहे हैं, or how they are actually generally interacting, via eye contact they are interacting, via touch they are interacting, or via what type of behavior they are interacting. You can see all the images in the slides very clearly. I have shown आई कांटेक्ट कर रहे हैं, एक टच कर रहे हैं, एक कडल भी कर रहे हैं, वो सारा पिक्चर्स यू कैन सी. नेक्स्ट इज आस्किंग द पेरेंट्स अबाउट द स्ट्रेसेस इन देयर लाइफ. कोई स्ट्रेस है उसके वजह से दे आर नॉट गिविंग प्रॉपर अटेंशन टू द बेबीज, और एल्स what is the exact issue that you all can see. Next is observe the child parent behavior. This is the same point which you had seen in the normal management. Then teach the infant about the teach infant care technique to the parents. How? By demonstrating them, or else by taking lectures to them. In the picture you can see, first picture says what? It says observation of the parents behavior. The particular child is being fed, they are supposed to, while feeding, it is being said in breastfeeding procedure, I have taught you all that how the particular parent should behave. She should focus on the particular kid, not like using mobile phone, watching here and there. In the first picture you can clearly see the mother is not at all aware how the baby is being fed. She is aware looking here and there, she's not at all taking care. Next is about teaching infant care techniques. In the third picture you can see the mother, how she's feeding, how the technique is being given, how the baby's position should be there. So either by demonstrating you can show, or else by teaching them कैसे करनी है या फिर नहीं. Last is about nursing process. For this I had given assignment, but still we will see just the diagnosis. We can see under की you can write. First is imbalanced nutrition less than the body requirement, related to inadequate intake of calories as evidenced by growth failure and undernutrition. This I had written on my own. If you want, you can modify and you can write on your own as well. Next is deficient fluid. For this, you have to maintain full plan. Whatever diagnosis I had given, only 4. You can add upon your own as well. Deficient fluid volume related to inadequate oral intake as evidenced by dehydration and increased intake and output. Next, impaired parenting related to lack of knowledge about nutritional needs and confidence in the parenting skills. These all points I had taken from the points which we have already seen कि पहले में क्या है, उनको knowledge ही नहीं है. First is imbalanced nutrition, कोई है. Next is deficient food volume. Then impaired parenting, parent को particular parenting skills ही नहीं है. Next is risk for impaired skin integrity, which is related to malnutrition और malnourishment. अभी भी चिल्ड्रन आर कमिंग. अब क्या ही करेंगे जब टॉपिक खत्म हो गई तब. एनी डाउट यू ऑल कैन आस्क. Any doubt you all have? Like see, assignment I had written in the same care plan on failure to thrive. You can include these process or you can exclude these and write others as well. Like you can write impaired growth and development related to failure to thrive as evidenced by. कैसे आप ग्रोथ एंड डेवलपमेंट को देख लेंगे. 5 डिक्रीज इन द वेट ऑफ द पर्टिकुलर बेबी और डिक्रीज्ड वेट गेन, जितनी थी उससे कम है. देन यू कैन again in the second one, like which I had written, imbalanced nutritional. So you can even write imbalanced nutritional status which is less than the body requirement related to inability to absorb the nutrients absorb नहीं हो रही. क्यों नहीं हो रही है? As evidenced by decreased feeding. कुछ खा नहीं रहा है इसीलिए nutrients भी नहीं absorb हो रही है. उसके वजह से क्या हो रहा है? Imbalances in the nutritional status of the baby. Next, you can even write parental knowledge deficit in the last point. You can maintain and write parental knowledge deficit regarding to the particular disease condition, or you can write regarding the treatment and the disease condition. Any doubt you all can ask now, and this PPT I'll drop in the group. Any doubt you all can ask. नहीं भैया तो please don't join in now. अब class खत्म हो गया, so that is why I am not accepting the other people, those who are joining now.
No problem.
Yuvraj, full time you never said anything. Now he's saying no problem.
Ma'am,